A brand new show that just dropped. While the presenters play dominoes, a special guest will be discussing all topics that matter to you. Everything from judicial, legal, health, wealth. Nothing is off topic. The name, you ask me? Domino Effect. Domino Effect. Come listen. It's time well spent.
Good morning, good afternoon, and good evening. Whatever time of the day you're watching the show, this is the Domino Effect Show. If this is the first time you're watching this show, this is how it works. I'm going to play dominoes, and I have a bunch of friends with me where we're going to play dominoes. My name is the Padre. This is Sweet Will. Tonight we have two special guests. We have, what name she has today? What name she has today? Nurse Pat, Lady KKB, or just...
Nurse Pat, we'll go for that.
No, I think it's Professor P today.
Oh, yeah, that is.
I wear too many hats.
This is Professor P, and just in case you don't remember, this is Sam. Simran, right?
This is my adoptive daughter,
yes.
Sim.
So, just in case you people wondering, every summer, Professor P always adopt one of her students to come and hang out with her. And last summer, she had Sim over, and she was playing dominoes with the Domino Effect crew, and she did not come out well at all on the Domino Effect.
She refused to bark.
She refused to bark when she lost.
Called me. She called me to bark for her.
This is my savior.
But the thing is, her boyfriend was the one that barked, though.
No, I barked too. Remember?
Oh,
yeah.
I came to the table and I barked for her. I got her back. Don't worry.
But here's the thing, though. Sweet Will, off camera, we were having this conversation, right? She says that she was playing She used to play basketball.
Oh my God.
In the 4th grade.
It was 4th and 5th grade.
It didn't matter. She said she was the tallest basketball player on her team.
It was 4th and 5th grade. I was the tallest person.
But guess what happened?
And she used to dunk.
Yes.
I did not.
I don't think she said that. Did she really say that?
After 5th grade, what happened?
I left. I quit.
I wonder why.
Because everybody started growing taller, so that I had to leave.
So the strategy. Oh wait. So the strategy. So if I'm understanding
I like that.
so the strategy.
That's sweet.
So whose turn? Did you come?
It's your turn.
So the strategy of the coach was pass the ball to Sam, right? To Sam, right? But here's the thing. So after when in the middle of the year from 5th grade, so they decide to not pass because everybody got a little taller. So they don't pass the ball to you anymore.
I don't know. I just didn't feel comfortable anymore.
Oh, okay.
I wanted to do dance because I did dance during basketball, so it was hard to do both. So I was like, okay, well I'm short anyways now for basketball, so I just.
It was an easy choice.
Yeah.
It was an easy choice.
But now. Okay.
It wasn't like pass it to Sam, pass it now. Don't pass it to Sam.
Yeah, no.
Okay, so now I heard that besides playing basketball, dancing, you're a track and field star?
From high school, I was, yes.
Okay. See, I'm telling you, dude, we have some very interesting people on this table.
I did all 4 years, both seasons. I did winter and spring.
Wow, indoor and outdoor?
Yeah, I did indoor and outdoor.
What did you do? It was like 400?
For indoor, for winter, I was just mainly a sprinter. So I always did like the 55-yard dash or like the 300. And then once it came to outdoor for spring, I was a thrower. So
Whoa.
I did.
What do you mean a thrower?
What?
I did
Like the
I
javelin?
did javelin and discus varsity.
Whoa!
Well,
That's awesome.
Wait. You talking about like the
Yeah, the javelin. I did javelin.
I like how he has no idea.
Hold on. How tall is that stick?
How long you should
How
say?
long is it?
Yeah, how long is it?
It's
Your
taller
turn.
than me. Like I don't know the exact dimensions of it, but it's taller than me.
That's cute.
Cute.
I can picture her like.
You can picture the form.
Yeah. It's
Your
like,
turn.
Yo, sing
No,
his
but
fit.
that's
So
active.
okay,
That's what's up.
but besides
That's
that,
active. That's
besides
what's
that,
It's
She,
your
I mean,
turn,
she's an
Sweet
all-around athlete. She was in cheerleaders. She was in cheerleading too.
In college, I was, yes.
Now, the main question, is this something that you didn't do? You did all the sports, you were active.
I didn't do that many sports. I mean, I don't
You were
know.
active.
I'm active.
That's
You know.
what's up.
Yeah.
That's good.
It's good to stay in shape. It keeps me young.
That's what's up.
Okay,
That's-
so
that's real
now,
good. That's
I
good.
think I think one of the reasons why I brought her is because now
Your turn,
that
Sweet Will.
all this exciting life is behind her.
Oh no,
No.
it's not behind her. What you mean?
Okay,
All this exciting life is behind
I
her.
mean,
we
yeah, but I mean,
we
I would
have
say-
barely touched the surface.
Well, the reason why I'm saying that, it says that after college, a lot of time, you know, people that finish college, they seem to like fall into this situation where they feel like depressed. They don't really want to talk about. They had a set schedule when they were in high school and college. Now they're living in an adult life where
Things change.
things change. So now, what is it that you do now? I know you went to one of those very prestigious college in Central Mass,
Oh yeah.
and you have a degree in nursing. Am I correct?
Yes, I do.
So, what is it that you do now?
So now I work as an RN. So I studied over the summer and I got my NCLEX. I passed the NCLEX and I got my RN license.
Okay.
And I applied for a job in Burlington, which is my hometown, and then I got in for the job. So now I work as an RN. I work on it's called a medical surgical telemetry unit. So I
Okay.
kind of have little bit of everything for like medical surgical. Like I'll have literally anything and everything, and then telemetry is like a little monitor that we'll like have on somebody, and it just monitors their heart rate and their heart rhythm. So we're like a very telemetry focused unit.
Okay. Recently, I had a little problem when I went to you remember last summer when I went to the I kind of passed out in the summer because I got dehydrated.
You were
And
raking. Yeah,
and after that they did one of those things. They went and tried to listen to my heart and all that. Is that
They
the
did an
kind of
EKG.
an
on
EKG?
you.
Was it, yeah, so it's similar. An EKG is a little bit more focused than
Okay.
doing telemetry. Telemetry will be continuously on you,
Okay.
whereas like a telemetry is kind of like a one-time thing, or it could be like a daily thing depending on the patient.
Okay. So how do you like working there?
I like working there. It is a little bit tough. I have been, I've only been there now for 6 months as a new grad. I have learned a lot so far, but it is still a little bit hard just, trying to just like learn the ropes of nursing, trying to do like the assessments, documentation, and sometimes even just like learning how to like talk to some people is a little bit different than like how you do it, like how you did it in nursing school.
Okay. So what type of training did you get from your current job?
So for the first 12 weeks, you are just on orientation. So the first week, Monday through Friday, you're just gonna have a bunch of classes, and it's kind of like a review of nursing school, and you kind of do like little simulation stuff with just other people who applied around the same time as you, and then after that week, then you would do like actual stuff on the unit. So they'll put you with someone who's a seasoned nurse or like an experienced nurse, and then you'll kind of be with them throughout like the rest of like the 12 weeks that you're on orientation there.
So what do they consider a seasoned or experienced nurse? Like how long do you have to have been with the hospital or that particular unit in order for you to be considered seasoned?
So what I've noticed is that for the people who it's been like people who would be there for like a year or so, and then those are the people who tend to be the one, like it's called precepting somebody. And I mean, I've had preceptors who were only like a year into being a nurse. I've had preceptors who were 2 years. I've had a preceptor who was like 20 years into nursing.
So it varies.
So it always varies. It's
Which one would you rather have? Because I feel like 1 or 2 years is not experience enough.
I'd rather have somewhere in the middle because I feel like having 1 or 2 years is like you are experienced and you have learned a lot, but then having someone who's like 20 plus years, I feel like might be a little bit harder because they might not be like with the times, I guess you could say, of nursing. Because like nursing has changed from 20 years ago to now.
Yeah.
Oh, okay.
Makes sense.
Yeah, because I was thinking I'm like somebody with like 1 to 2 years is probably not experienced enough. But the way you put it, okay, I can.
Yeah, but at the same time, technology changed. The person with the 2 years, the person with the 2 years may know new things, but the person with 20 years may not may be stuck into their own ways.
Okay.
Yeah.
They want to show you their own ways, but they don't want to change with time.
Yeah, exactly.
Right?
Yeah.
Cool. Okay.
So, do you feel like your nursing school prepared you for your current role?
So I'm kind of bittersweet about this. I feel like there were some things of where it did teach me, but then other times of where it just didn't teach me at all. So when it came to like clinicals and like lab simulations that we would have as a class, I feel like it didn't really prepare me as much. And even when it came to the class, like they'll always say, oh, like, you know, we're learning about this disease, this disorder, these are the signs and symptoms, this is how the treatment is. But then it's like, we'll never actually see that, you know, in clinical, like in the actual field. So it's kind of just like, how can I incorporate, you know, what I'm learning in nursing school into clinical? And, you know, I've had a couple of, you know, clinical instructors who have been very, very good to me. And I feel like I've learned a lot more through that person than through school, than my 4 years of being in nursing school.
Okay. But now that you said that, if I'm calculating this whole process, from the time you graduating, so I would say that you're kind of in between COVID years.
Yes, I was the COVID nurse, COVID nursing student. I was.
Okay. So how? Okay, you know, I'm not trying to go around, but how tough was that for you?
That was very tough for me, I would say, because I can't learn online or like on a screen. Like on Zoom, we use Zoom, and I could not do that for the life of me because I just can't look at a screen and then because I get distracted by my phone, by my laptop, by other things. So I like to learn like in person. Okay.
So now but don't you think that that would have helped you adjusting with this new iPass, with this new way of doing things where you are now?
I mean, I guess so. I don't know. I feel like COVID kind of also like ruined how like I learned things in nursing school because it was just a big transition of things. Right. And it was just very hard to like switch from one thing all of a suddenly and then switch right back after kind of COVID was over. Yeah. I guess you can say. So it was very challenging, I would say.
All right. So so now that we're talking about that, now I have a question for you. I know there's a trend that's going on. I think we probably talk off air. So now,
your turn.
You know I was gonna come up with that. So,
you knew that was coming.
I knew it was coming.
So you have a teenager at home, and I think we had
the conversation with Matthew.
Yeah,
about
I had that conversation with Matthew before, and how many Stanley Cups do you have?
I own 0.
Wow.
Yeah, I don't have one either.
And how about Yetis?
None either.
Okay, so wait. So you're a nurse and you don't possess a Yeti?
Okay. My mom has a Yeti, and sometimes I'll just like use it. So I always buy like off-brand, like the Stanley Cups. I'll always buy off-brand Yetis because I'm always just like, it's so expensive. They break easily for no reason. I've always been a Hydro Flask girl, and I always will be.
This dude is a big fan.
We own Yetis and Hydro Flask. They're really good. They're really good.
Because you can put ice in it, and it will be cold.
It lasts for a while.
Yeah, it'll last for a while.
I will go for that over a Yeti. Definitely.
I still have my Hydro Flask from high school. One of my friends one time got me a Hydro Flask for like my birthday, and I still have it like after like 7 years. I've dropped that on like concrete, like the pavement, like you name it, and
yeah.
it's still like in
Nice.
perfect
They're
condition.
durable. They're very durable.
Whereas like I've seen those Stanleys drop at my work and they'll break right there.
All right. So now you're a nurse. I know the big thing that a lot of people talk about, Crocs.
That's another thing too. I don't own any Crocs.
What?
No,
Okay,
but-
so
but-
wait,
no, no,
wait.
no.
Dude, I'm not talking
No,
about
no.
I'm not talking about the. I know. No, stop.
They
I know
are
what you're talking
special
about.
nursing
No,
shoes.
see,
Looks
that's
like
what I'm
Crocs.
talking
No,
about.
no,
I'm
no,
not
not
talking
the
about.
nursing. No.
I'm
You're
not talking
talking about the
nursing Crocs.
clogs. You're talking
Like
about
clogs.
the dance
Yeah.
shoes. No, he's talking about the Crocs.
Crocs. I'm talking
actual
about the.
Crocs, yeah.
Like,
yeah.
does your daughter have Crocs?
Oh my God! But
See,
oh my
How
God.
that's
many?
what I'm talking
how
about.
many Crocs does your daughter have?
She has 2.
Okay, so I have
Yeah.
like 4.
Yeah, but here's the other thing. I don't know what they call because I'm not
Gibbets.
into.
They're
Okay, there you go.
gibbets.
Exactly. Do you know what that is?
The
decorations.
the charms
They
that
call
you
them
on
charms.
them.
These are expensive. My daughter
Yeah.
trying to get the Crocs to trying to get. Each one is
Like
that's expensive.
$5.95.
Yeah.
Sometimes
Exactly.
but you can get them off of Amazon. You could get like a package
I'm
for a
telling
cheaper
you,
price.
it's insane. It's
Marcus,
like everywhere
your
you
turn.
go. Oh, it's my. Is it? Did you
No, I
win?
already went.
And then I win.
Oh.
That's it. Will didn't come and play anyways.
No, he did not. You
I
did not
passed him
come to
about
play
500
today.
times.
No, because I was listening to the conversation.
Yeah,
It says-
sure you
So one thing we want to talk about is, was there? Well, we did not talk about your past career before you got into nursing school. So what did you do before becoming a nurse? Because I think that's an interesting topic.
So I became a CNA, which is a certified nursing assistant. I became a CNA for about 2 years, 2.5 years, and this was right before COVID hit.
Okay.
So I had like a couple of months before COVID hit, and then all of a sudden COVID hit, and I was in a nursing home. So I was there for like 2 years, 2.5 years. After that, I quit that job because I wanted to become a CNA in a hospital, and I was at Tufts for a while. I was
Okay.
there for about a year, and then I became an EMT because I started to like love the emergency type of like care.
Okay. All
So
right.
why did you become an emergency nurse instead?
So I actually did apply to many ER nursing jobs, and I was declined for all of them. So then that's when I kind of just went on to like, I applied for medical surgical units and I got into them. But I did apply for like ER and ICU jobs, and I just couldn't get in for any of them.
So sounds like okay. How did you set your priorities? By I mean, it sounds like you had some goals.
Mm-hmm.
So how did you set your priorities?
I don't know. I just kind of went with the flow, honestly.
Okay.
And just went for it. Go with the flow.
Go with the flow. So all right. So it sounds like you're enjoying yourself as far as the nursing. So what shift are you working?
I am strict night shift.
Okay. All right. But you're pretty young, so you don't have any problem with the night shift.
At the moment, I don't. I do like the pace of it because the pace of night shift tends to be a little bit more like calm
Okay.
than like how day shift. Because when I was on orientation, we flip-flopped every month from day to night. And I just started to love the night because of the pace was much like slower, and I was able to like focus more on like the patient, focus more on the assessments, like how do I document, what do I document. So
well, you're so sweet.
I felt like it was more,
you shouldn't have.
like it was a better pace for me.
Okay. So what are some of your your favorite part of nursing?
Honestly, I would say the patients would be like my favorite part because there's been
that sound kind of like far-fetched and
So
cliche.
well, speaking no,
let me
Speaking from having,
let me
It's the
finish.
patience.
Let me finish.
Let me
Exactly.
tell you why.
Let me finish.
So Sim is actually very curious. Like when you give her a patient, she doesn't just look at
All right,
the
no, stop.
diagnosis.
Now you really need. Okay, now we invite. I mean, one of the reasons why we invite Professor P on the table is because we don't have. I mean, we have some of our crew that are not around, so that's why
I'm at the
Professor B's
table.
at the table, and of course we need somebody that understand nursing better than we do.
Yes.
So that's why we had Professor P on the table with us with Simran. But at the same time, we also thought that Simran was gonna be a little shy, but it looks like she doesn't give a damn.
No.
No, Sim is not shy.
He's like, no.
So, but yeah, let me repeat what I said. That's
You think it sounds cliche. However,
Exactly.
the
You
reason
know what
why
I mean?
I stepped in is because you don't know Sim as I've gotten to know Sim.
Okay.
And I've seen the way that
Okay.
she treats patients and their family members, and she's very curious to know them, not just from their diagnoses, but to truly know them, to have a conversation with them, to know what makes them tick and why they're where they are and why they do what they do. So it's not just about, okay, this is just a person in a bed and I have all these workflows and I have all these things to do. It's about who they are, why they're where they're at, and how can I make them better. So when she says it's the patients, it's because she wants to investigate. She wants to find out. She has a curious mind. So now you can speak for yourself.
Exactly. No, I like to learn about my patient. I like to know why they're here. And it's like the family members will always come for their mother, daughter, father, whoever the patient is. And just I'm always talking to them, trying to make them feel good. And, there was one patient that I had a few months ago, I think 2-3 months ago, and she was a nurse for 20, 30 years. And she was very, very sick, was in the hospital. And we were always just chit-chatting. I was giving her meds, I was always doing an assessment on her. And I was always just very careful, being gentle and just talking. Because a lot of those patients are just really, really lonely in that hospital. And doesn't matter where you are, whether it be a nursing home or a hospital, they're always lonely. And just talking to a patient, even if you take 10 minutes out of your time, then it's all that matters to that patient. And the patient ended up writing a letter back to my managers and was hey, I believe that Simran is really charismatic. She was super sweet, very gentle. And, she has and she was super knowledgeable and all these sweet things about me. And ever since I had that, and they always say it as a shout out at 7 a.m. every day for just any patient shout outs. And that's when I first was just you know what, I'm doing this for the patients. This is when I was
I have a question. So let's say you get a patient, you just said you get a patient that's been in the field that was a private nurse that was for 20 years. They were there for 20 and 30 years and whatnot. And then they got, let's say they have their father or mother and whatnot in the hospital. Now, do you find it hard, let's say your doctor tells you to administer this or whatnot and stuff like that, and now she was a nurse for that amount of time, and now she questioned what you're doing. Hey, why you doing this? Da, 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 and now you got to break it down. Where somebody like me, I don't know anything about nursing. You tell me something, I'd be okay, cool. You know what I mean? I will take your answer and I'd be all right, cool. Where she knows exactly what you're talking about, and now she will challenge you. Now the work becomes kind of a little longer. Now you have to explain things a little more into detail because they know exactly what the hell you're talking about, and now they want to question it. You know what I mean?
You want to clue him in?
So this is what I would do. So if someone who is just they don't have any idea whatsoever, I'll treat them the same as somebody who does know and who doesn't know. So same for someone like you, say you had a question on a medication, I'll always research the medication beforehand, maybe write down some quick notes, but for the most part now I kind of know all of these medications now and what they're used for. So and then, but for someone who is already in the medical field, I'll always tell them what it is. And sometimes they even add on to it. There have been a couple of patients who have been a nurse for many years or a family member who's been a nurse. and they'll always challenge it, being like, oh, you know, that's not what that medication was for 10 years ago, or they'll always say something random. But but you're just like, okay, well, that was 10 years ago. Like, this is how it is now. Like, I'm telling you now, like, this is the medication we'll be giving, you know, to your, you know, husband, you know, wife, daughter, whoever. But for someone like you, if you ask me the same exact questions, like, what is this for? I'll tell you what it is for. You know, I'll tell you side effects, all these things, just so you are aware.
And here's the thing, Sweetwell. One of the things that we do.
Is it my turn?
Sim's
No, it's my
turn.
turn.
When we're in the hospital, as a caregiver, as a clinician, we rarely tell providers that we're nurses. Because one, we don't want them to be worried that they're on a telescope, that they're under, what I mean is that they're under a microscope being looked at for what they're trying to do, for the care that they're administering to us. So we don't say what we do for a living, because we want people to dumb it down for us. We want people to tell us the honest truth, and we want to sometimes catch our caregivers unaware, for them to be having an honest conversation. Like, I can tell you something real quick. I had something happen to my eye. Okay. The doctor came in and told me that my eye was perfectly fine. However, he was having a conversation with his colleague outside the door, and he said, she will never see in that eye again. But he was saying it with medical terminology, and I was crying. And I went, so as I was crying, he's sitting there. He's like, why are you crying? I said, you just said I have 90% chance of seeing in my eye again. He's like, there's no way you should know that. I said, I'm a nurse. He's like, you never told us. I said, so then you wouldn't tell me the truth. He's like, no, I did tell you the truth. We're going to do everything possible to make this work. But he says, but in my opinion, I don't think you'll ever see in that eye again.
Do you think it's fair where if you had told him that you were a nurse, he would have given you the full details? Where you didn't tell him it was you were
special treatment.
Here's the thing. Here,
Like,
let me explain.
Let me explain.
Go ahead.
Let me explain. So now that I am officially a nurse and I have gone to like doctor appointments and everything, even I have noticed doctors, they will actually treat you differently if you work in the healthcare field versus if you don't work in the healthcare field.
Okay.
So I had to go to a GI doctor, a gastroenterologist one time. And he was like, you know, dumbing everything down for me, you know, kind of talking down to me. But when I told him, hey, I'm a nurse, he was like, oh. And then he started actually speaking to me like professionally. Because I also work in the medical field. Like I'm aware of many of these things.
Let me tell you why they do that. When you don't know anything about the medical world, they dumb it down to give you hope. When you work in the medical field, they know you know what they know. They just give it to you bleak. They're point blank. And I think being able to give you hope by dumbing it down is the best thing that they could do. Because if they had told me point blank period, you will never be able to see out of that eye, hope would have been gone for me. And I would have been devastated. The fact that I heard it devastated me. The fact that he said to me in the room, dumbed it down and said, yes, we're going to do the best that we can to take care of that eye. I was happy because I had some hope that I'll be able to see in that eye. But when I heard the bleak truth, I was like, oh my gosh, I'm going to be legally blind. And am I legally blind? I am. The glasses make me not legally blind, but without the glasses, I'm legally blind in one eye. They did the best that they could to repair my eye. But I had that hope. It's giving you that glimmer of hope. And as nurses, we do it all the time. We could know that a patient has 1 week to live, but we still give them that hope. We still give them the best care. We still hold their hand. We still care for them as if they have 100 years to live.
Technically, we aren't supposed to like give hope to a patient.
We're not.
But I always try my best to do that. And I know we're not supposed to. But I just still do it, even if it puts a smile on their face for just 2 seconds. That's what warms my heart as a nurse.
Yeah, but like when you give them hope, to them it's kind of like a promise. They're like, well, you promised this and this and that.
You sound like a politician.
I'll be able to.
See,
you know what I'm
here's
saying?
the thing.
They kind of hold you to that. That's the thing.
You're not saying they're going to live. Because when they turn around and they ask you, you know, will I live to be 100 years old? You say nothing is promised. You're here today. You're here right now. We're going to take care of you right here and right now and treat your symptoms. Right, Sim?
So Sim, would you recommend going to anybody? I mean, would you recommend going to nursing school?
So,
I know I'm in my 50s, but I mean.
So here's what I think. So I struggled a lot through nursing school, you know, mentally, emotionally, even physically, I have. And I have also had a person who was in nursing school, and she was in her 50s, and she had like 2 or 3 kids, and she was able to do it.
Okay.
So I struggled a lot, and nursing school is no joke. It's very challenging. It is very hard. You know, you do honestly have to make a couple of sacrifices, and that means of just like not being able to hang out with your friends, not being able to go to a birthday party, not being able to go see your family. And I did have to make a lot of those sacrifices with my friends and family, and that was like the hardest thing for me.
Okay.
So, but the reason why I did want to become a nurse was because I love caring about people. And I love caring for people. You know, I know a lot of nurses, they always say, you know, you want to help save lives.
But there's good money in that too.
It is good money too.
Money. It's just, if you, so let's say, if, you see how you say you work hard and stuff like that to get what you want and whatnot and stuff like that. Let's say you didn't have to work that hard. It was easy to just become a nurse and stuff like that. You wouldn't value it as much, and you wouldn't take it as
oh no, yes.
You know what I'm saying? But the fact that you had to work your butt off, you appreciate that.
No, yeah. And I have actually like seen a couple of those nurses though, like in nursing school, of where it's like they just got by like super easily.
Yeah.
You know, they always had like a big friend group, like it was always fun for them. And it's like now I see them out in the field, and it's kind of just like, you know.
Like it is what it is. But like, yeah.
All right, guys. It was a pleasure having my adopted daughter on the table with us. I know we want to talk more about this, but you know,
time flew.
Times fly as when we're having fun. So it was a pleasure having you. And once again, remember to subscribe, like, and share this podcast. Thank you. Good night.